During childbirth, prolonged labor, intense pushing, and increased pressure can all lead to a frequent complication, hemorrhoids. But a new device, the first of its kind, aims to prevent that during vaginal childbirth. Joining us to discuss this is Dr. Daniel Burns, Chief of Obstetrics and Gynecology at Niagara Falls Memorial Medical Center. Welcome to the show, Dr. Burns.
Thank you for having me, Jackie.
Dr. Burns, a problem many women experience during childbirth is hemorrhoids. How big a problem is this? Does this impact a lot of patients?
You can look at it two ways. One is it's about 1 out of 3 women who deliver vaginally will develop painful external hemorrhoids, which translates to about 750,000 to 1 million births per year.
So tell us how this new product, the Hem-Avert Perianal Stabilizer, prevents hemorrhoids during labor and delivery.
Well, to understand how it prevents it, we have to understand that during a woman's prenatal process, she increases her blood volume by approximately 1.5 liters. This extra blood volume will oftentimes pool within the pelvis, thus increasing the pressure in the veins around the rectum. The increased pressure, then when a woman pushes, will cause the overriding of the rectum and thus formation of hemorrhoids.
Dr. Burns, let's explain a little more of what actually is happening during childbirth that causes the hemorrhoids.
There's an increased volume of blood, which increases the pressure, and a lot of blood, just due to gravity, will pool in a woman's pelvis. And the labor process has several stages. The second stage of labor is when a woman pushes. As you can imagine, that is an intense increase in pressure. That will cause the rectum to be forced out, which increases the chance of it forming a hemorrhoid, which is actually just an outpocketing of a vein. What the Hem-Avert does, it supplies that counter pressure to help prevent that process.
Why don't you hear a lot about it?
Well, I think that's a couple answers. One is women don't really want to divulge that they're having a problem with hemorrhoids. It's not something we talk about at lunch, per se, with friends. Another reason is it's been overlooked by obstetricians for years, so I think it's been pushed under the carpet somewhat.
Why would it be ignored by obstetricians? Now, I must say that I have heard about this frequently as a mom, and among my circle of friends, it's such a common thing, I guess, it's like a punchline of a joke, but to have, obstetricians take this seriously, you say they weren't at first?
Well, I don't think we don't take it seriously, but we've not had anything to prevent it or anything to really do about it in the past. So now we do. So that's why you're hearing more about it.
So this problem, the hemorrhoids caused by childbirth, doesn't just go away on its own then?
Oh, no. In fact, at a woman's 6-week postpartum visit, which is a fairly routine, 24% of women will have painful external hemorrhoids. At 6-month follow-up, 14% of women will still have that external hemorrhoid.
Why hasn't anyone addressed this issue before? It seems like, somebody would have come up with something till now.
Well, just because there's been no treatment for it. And I think in medicine, when you don't have a treatment, you don't address it as directly unless someone brings it to you. And a lot of women don't complain about the hemorrhoids. That's kind of what they look at as collateral damage during the childbirth process.
It's the price we paid, right? Like that.
As women.
Exactly. So up till now, what's been the standard of care for women who get these hemorrhoids during childbirth?
Well, it's what we call palliative care in medicine, which basically means we treat the symptoms that exist. For example, there's foams, creams, sitz bath, donut rings that women sit on, all of which treat what's already been damaged, not treating the problem, which is actually the prevention of the hemorrhoid.
That is a huge distinction, trying to prevent it from occurring in the first place. Wow. So talk about what you're doing differently now for your patients to help prevent the problem. What's going on?
It's simple. I'm using the Hem-Avert Perianal Stabilizer.
How exactly does it work?
Well, as I stated before, it will just supply counter pressure. During a delivery, an obstetrician or a midwife will oftentimes supply that counter pressure manually with their hand. But as you can imagine, there's a lot of other things going on in a delivery.
They're kind of busy.
I think the thought of preventing the hemorrhoid kind of goes by the wayside. And what happens is that hemorrhoid will form. And what the perianal stabilizer will do, the Hem-Avert will supply that pressure so the obstetrician or midwife doesn't have to.
Does the application of this device hurt the patient?
Oh, not at all. It's very non-obtrusive. In fact, it's welcomed by the patient once they feel it. It's very non-obtrusive.
And as far as being non-invasive, it's non-invasive as well.
It's completely external and comfortable.
So, Dr. Burns, what has the response been from your patients when you've used this device on them?
It's been very positive. They find it very non-obtrusive. They find it comfortable, and they've welcomed it.
And afterward, what do they say?
The feedback has been extraordinary. I have had several instances where women have dealt with hemorrhoids in the past, and when I see them the following morning after delivery, they're feeling like $1 million, and they thank me for coming up with this new product.
Fantastic. How do women get access to the Hem-Avert then?
Well, that's simple, hemavert.com.
And now this isn't a product that a woman would just call up and order herself. Is this being marketed to hospitals? Where is this being?
Well, right now it's in its embryonic stages, and we're trying to get this into hospitals, which will then offer it for every delivery, hopefully. But patients cannot just call up and buy one themselves. Their doctor has to have availability to it.
Well, it certainly seems to me that this is a product long overdue. So, Dr. Burns, thank you so much for sharing your knowledge with us today.
Well, thank you for having me.